Hi everyone, Amber Kenoy here for Everyday Kentucky, and May is Mental Health Awareness Month, and Mandi Snell is with us at Solutions Functional Medicine. Welcome, welcome. I know that hormones have to play into our overall mental health because it seems like we're finding out that they play into everything.
Yes. You are not wrong. In fact, this is one of our favorite subjects because there are so many, it's absolutely predictable in the adult life that you're going to have decline of hormone. It's misunderstood or underappreciated how much hormone plays a role in our mental health. So just speaking of women alone, women begin to lose testosterone at 1 to 3% a year starting at age 30. They lose testosterone when they decline ovulation at age 40, and then the estrogen around age 50 typically. How metabolically active is the brain with these hormones is so underappreciated. How many pharmaceuticals are we prescribing for clients between the ages of 30 and 50 for things that just merely may be mitigated by healthy hormone replacement? It's amazing. In fact, when it comes to testosterone, one of our favorite pieces of literature, we have at least 40 articles in our office to talk about the role of trace testosterone healthily used in women who have low testosterone and its regulation for mood disorder, how it can be done, and even more potent than many prescriptions available today. So we love to give the people opportunity to have this replacement and reoccupy those receptors that can be responsible for things like brain fog, anxiety, and depression. The industry right now doesn't consider hormone to be a first-line drug of choice to help mitigate these things, but I think time is going to change that.
Absolutely. I think a lot of people are going to probably push back because traditional means just don't seem to be working as well. There has to be some other underlying things going on.
Well, what we try to do without being critical of the industry is just invite people to, well, just test the fruit.
And do their own research.
Do their own research.
Yeah.
And when they want to do research, we would love to be their librarian because we keep those studies here. We're very proud of these in forms of long bibliographies to let people make their own decision about how they can find these opportunities to help themselves. And I didn't even mention men yet. You know, the role of testosterone in men in mental health, it cannot be understated. You know, unfortunately, men may consider from some taboo about historical use of testosterone have to do with maybe sexual prowess, strength, but and they may perceive that because they have normal sexual function and desire below their waist, as I say, they may figure, well, my testosterone must be fine, but these same men are struggling silently with depression, low motivation, anxiety, low mood, not to mention joint pain and brain fog as well, and they're not sleeping very well.
Yeah, well, when you don't sleep well, you don't feel well in general. I mean, that affects you overall.
Yeah.
So if people have questions about that, if they want more information, if they want testing, how can they go about it?
Well, we would love to help them. We want them to feel at ease that we're going to help carry them from the level of knowledge that they have. Even if we call it our freshman client who really has no knowledge about hormone, that this is a safe place for them to call. We call it our inquiry consult for those people who are inquiring minds who want to find out a little bit more, and we'll carry them through to our session, lab work, and help them feel like they're informed, they can make a great decision.